Welcome back, America. I'm Hugh Hewitt. Last week I was on vacation, and I don't normally work on vacation, but I heard about Ari Parker, who is the co-founder of Chapter Medicare, who joins me now, and I wanted to connect with him, so we did. Ari, I just pulled out of my wallet 7 cards, all of which have something to do with my Medicare policy. And that's because I've changed 3 times in 3 years, and I never know which one is legal, so I don't throw anything away. And then you tell me that I am not unusual, that actually, I'm a pretty good lawyer. I was an administrative lawyer, general counsel of 2 federal agencies. I found this to be a nightmare because it's a big data problem, and I don't know big data, and you've got it figured out. So tell people about Chapter Medicare and why you and I are going to work together.
Thank you so much for having me on, Hugh. It's a delight to be with you and your audience today. Chapter is the only independent, unbiased Medicare advisory. Let me tell you why. We evaluate all your plan options. There's over 24,000 options nationwide, if you can believe that. That's why you have 7 different cards that you just pulled out. And we help people with no charge and no strings attached. Now, if I may, the inspiration for Chapter came from helping our parents. My mom got laid off during the pandemic. She needed help transitioning to Medicare. You can order a pizza on your phone in 3 minutes. But starting Medicare involves dozens of phone calls and piles of paperwork. As you mentioned, it's a nightmare. And there's 11,000 Americans turning 65 every day. They're bombarded by confusing mailers, unsolicited calls, and Joe Namath commercials. So Chapter is here to help people cut through the nightmare.
Now, what you and I talked about is I realized pretty quickly that depending on what zip code you were in, what plan you wanted, what drugs you used, if you used drugs, if your doctor was in a program that was in or out. It's a big data problem, meaning 24,000 plans. I don't know if that includes the drug plans, but there's Part A, Part B, Part D, and Part G. That's what I get. And it's all in a book that makes no sense at all. You've done all that work, and you've, programmed all that data into a set of choices so that people just need to give you data and outspits the preferred benefit, and you can change once a year, correct?
That's exactly correct, but let's personalize this. Being on the wrong plan means you won't be able to access life-saving healthcare when you need it. Not to mention, it can cost tens of thousands of dollars out of pocket. So this has real consequences for your audience, for their health, and for their wealth. And so we take a personalized approach based on our technology platform. We analyze all 24,000 of your options nationwide. You'll have a one-on-one conversation, and we'll go over your 3 Ps. Your 3 Ps are your providers, what doctors do you see, your prescriptions, what medications do you take, and then your priorities, what is important to you. And then we'll find the exact plan that meets your healthcare needs and transform this nightmare into clarity and provide you with peace of mind for you and your family.
Well, I don't get to open season until October, then I get to really test you. But what do you do with people like me that move around the country? And I mean, 2 or 3 times a year, I move around the country.
Well, Hugh, there's 2 types of additional coverage, and this might surprise people because they assume, well, if I just have Part A and Part B, that is original Medicare, then I have comprehensive health insurance. Not so.
Not so.
You still have a 20% gap under original Medicare, and there's no out-of-pocket maximum on that 20%. 20% of a very large hospital bill is thousands of dollars, and some seniors unfortunately declare medical bankruptcy as a result. So we need to make sure that you're on the right plan for your healthcare needs. And in a 15-minute call with someone, we save our members on average $1,100. You mentioned the fall. The fall is a great time to review your coverage. However, if you have an opportunity to switch your plan, then we might be able to help you now, especially if you're on a Medicare Advantage plan, because right now is the Medicare Advantage open enrollment period, which offers people an opportunity to adjust their Medicare Advantage plan if there's something suboptimal about it.
Now, Ari, again, I think I'm a pretty smart guy. I was just covering the Ukraine-Russia war pretty well. Just went over, the Mohammed Khalid arrest and deportation proceedings. I get most. I still don't understand the difference between supplemental and advantage. Okay, I've been doing this 4 years.
Let's break it down. Picture Medicare as a 3-legged stool. 3 parts to Medicare. There's your hospital benefit. That's Part A. That means you're inpatient. Then there's Part B. That's everything outside the hospital. That's your outpatient
80%
coverage.
of it.
Most Americans, exactly. It covers 80%. You got it. You owe the other 20% out of pocket. Now, there is a monthly charge for Part B. It's $185 per month. The final leg of the stool is Medicare Part D. That's your prescription benefit, your drug coverage. D is in drugs. Now, most Americans need to consider some type of additional coverage to get that 20% and their drugs covered. There's two options here. So though there's hundreds of insurance companies offering thousands of plans, in a one-on-one conversation with Chapter, we'll sort through your two different flavors. And those flavors are Medicare Supplement, which is also known as Medigap. This is the most comprehensive and flexible type of coverage. It's great for travelers like yourself. The second option is Medicare Advantage. Medicare Advantage is a replacement for original Medicare administered by a private insurance company. It typically comes with your drugs included, and it's lower cost than Medicare Supplement, but there are trade-offs to consider, really important ones. And if you go the Medicare Advantage route, then we need to know your doctors, your drugs, and your priorities to make sure that you're on the single best-fitting Medicare Advantage plan.
Now, I'm going to talk to you through the break and put it all over on the YouTube channel as well. But I want to make sure we are on in Pittsburgh, so we have to slow everything way down. Ari, I mean, those people are slow there. So to find you, they go to askchapter.org, or they go to their phone, just any old phone, and they hit the pound sign, and then they put in 250, pound sign 250, and you ask for Chapter Medicare. Did I say that correctly?
Chapter Medicare. We'd love to help your audience.
But I mean, why do you do it that way on the phone? You just hit pound, hashtag pound 250. Why do that instead of a phone number? Do people find that easier?
Yeah, many people do find it easier, in fact, because they're driving while listening to you.
Okay, pound 250, Chapter Medicare. And I'm going to talk with Ari about D and why you get sent from, my maze involved 4 consultants. That's one of the things I like about Ari. You train your guys, right? Not you get one guy with you and you train, or one gal, and you've trained them yourself.
We only hire the best of the best, and then they go through a rigorous training and ramping program with yours truly.
Yeah, because I got to tell you, it's a bell curve and everything, and if you're throwing darts based upon the fact that you don't know anyone and someone said this, or you're going to your parish bulletin, it's not a good way to pick a plan. It really is not. And the guy, that really lovely people, they tend to be older folks. I think they are coming from their job at greeter at Walmart to tell you how to spend the rest of your life in a hospital care situation. It's not what you want. You want to talk to a young data cruncher. And by the way, how long did it set up to set up the program, Ari, to do the data crunch?
Oh, well, the data took a couple years because, as you can imagine, the insurance carriers and government data isn't standardized. It's fragmented. And there was a lot of red tape and stonewalling to cut through in order to build our remarkable system that allows seniors to search and evaluate all 24,000 of their options.
Are you the first mover in this space? Someone figured out all these old people are lost in the woods? Are you the first guy to figure it out?
Yeah, the whole reason we exist too is because of Medicare's broken incentives. Our North Star is we will always match you with the plan that meets your healthcare needs.
All right, go right now. Stick around. Go over to the YouTube thing. I'll talk with Ari for another 5 minutes. Sorry, we're back here. We got 5 minutes, and I want to cover something you and I covered when we were doing our talk last week. I couldn't figure out, I'm always, as a lawyer, I'm just curious, why is it working this way? And you call one consultant, they send you another consultant says, I don't do drugs anymore. And then you told me Biden changed something with the drug. Who gets paid along the way? How does it work?
This is the whole reason we exist, Hugh. You hit the nail on the head. It's because of the Medicare industry's broken incentive model. We are the only company that has managed to break the status quo and put seniors first by allowing them to evaluate all their options, not just the ones that we earn money from, but all their options.
And so how many people are you signing up on a daily basis? I mean, how are you rolling out?
Well, we've helped tens of thousands of people already, just in the last quarter alone, in fact. And as you mentioned, there's a silver tsunami, so we can't wait to help the 11,000 Americans per day who are turning 65 or coming off their work-provided coverage.
Yeah, and so when Elon looks at this and says, we can save money on Medicare, he's got to be right?
Yeah, this isn't a surprise to you and your listeners, but the government isn't great at building user-friendly websites. In fact, we all remember the Obamacare portal's initial launch failures. And so there's a huge opportunity here to improve what Medicare.gov can do. Because right now, if you go to Medicare.gov and you try to sort your Medicare Advantage plan offerings, you can't even find whether your doctor is in or out of network.
Been there, done that. It's the craziest damn thing. They can't do anything, and they've been trying to do it well for 25 years. They can't do it at all. So are you public or are you private?
Private.
And when are you going to go public?
That's a great question. Our CEO testified in front of the Senate Finance Committee on things that we can do in order to improve Medicare, specifically on how the Medicare.gov website itself can be improved. And we can't wait to help seniors navigate this bureaucratic maze and get through the nightmare and find peace and clarity on the other side.
Whenever you do your initial round, call me up. Because when technology meets need, at that intersection, there is wealth. And it's because you're providing a service. And it is the most broken, stupid system that has been built. Pathway evolution is a term of art in the insurance business. Pathway evolution is evident in the chaos that is Medicare. But you're figuring out, Ari, congratulations on that. I look forward to working with you for a long time. Ari Parker is co-founder of Chapter Medicare. Remember, hashtag 250. It's pretty easy. Go to your phone, hashtag 250, ask for Chapter Medicare. Talk to one of their people about whether you're turning 65 now, whether your parents are turning 65 now, whether you've had a change in circumstance, like you're moving from a private plan to retirement, or you got divorced, spouse died. I think that counts, doesn't it, Ari? That's a change in situation that qualifies you for open season?
Well, there's a lot of change in circumstances. So if you've experienced something that is a change, then it's worth speaking to speaking to our team.
Good advice. Ari, thank you. We'll talk again at length. You've done a public service day. I appreciate the time. Be well.